Hi everyone, what do you mean by DICE? By DICE, I did not mean the DICE DICE. I am talking about DISE DICE. DICE stands for Drug Induced Sleep Endoscopy. As the name implies, drug is given to induce sleep in the patient so as to look for snoring. And why is it done? It is to assess the level of obstruction which is causing snoring and sometimes obstructive sleep apnea in the. What are the indications of DICE? In upper airway resistance syndrome, primary snoring, obstructive sleep apnea. To assess the level of obstruction, it can be done. And in case of failed CPAP and failed sleep surgery, also you do DICE. And before starting the patient on MAD, also you can do DICE. Drug-induced sleep endoscopy most importantly assesses the level of collapse, and with that you can choose the surgery that will benefit the patient best. The patient is induced deep sedation. The sedation should be deep enough so as to cause 2 to 3 episodes of snoring, and to ensure that there is adequate level of sedation, you can have a bispectral index monitor, and the bispectral index should be between 61 to 70 to ensure the adequate level of sedation. Agents used for DICE include propofol, dexmedetomidine and midazolam. The dexmedetomidine is supposed to be the best in terms of not altering the sleep architecture. However, the disadvantage is that it takes longer time to act and the longer time for coming out of sedation. WORD classification is used for assessing the level of collapse. WORD stands for velum, oropharynx, tongue base and epiglottis. So at the level of velum or the soft palate, it could be an anteroposterior, lateral or circular collapse. Whereas at the level of oropharynx, it will be only a lateral collapse, and the tongue base, it can only be an anteroposterior collapse. Whereas at the level of epiglottis, it can be a lateral collapse as well as anteroposterior collapse. This patient had an AHI of 63. His PMI is around only 23. However, look at the AHI. So we had to do a drug-induced sleep endoscopy, and you can see how much collapse he is having at the oropharynx level. And you do not do a drug-induced sleep endoscopy and then start a patient on CPAP. What if the patient is having an epiglottic collapse? It can only worsen the condition. So there lies the importance of assessing the patient with DICE in case of primary snoring as well as obstructive sleep apnea syndrome.